السلام عليكم. معكم الدكتور عبدالله مشني. اليوم حنتكلم عن topic مهم جدا في implant dentistry, and that's the integration of multiple workflows, digital workflows in implant dentistry through implanting. For example, we have patients walking to our clinics having problems of missing teeth in multiple areas of the mouth, and we need to integrate different levels of workflows in order to come up with a final treatment plan that works well for this patient. So specifically today we'll be talking about how to integrate restorative components and surgical components in order to come up with a comprehensive treatment plan that works both for our patient and for both the surgeon and the restorative dentist at the same time, with minimized effort and very effective communication. All of this in order to come up with the most efficient communication between the restorative dentist and the surgeon who is placing the implant. And we need to have this communication very efficient and accurate at the same time to reduce the marginal errors that can happen during the surgery and during the restorative phase while placing the final restorative crowns on the implants. So stay tuned. احنا اليوم هنتكلم على multiple levels of digital workflows that can be integrated all together in order to come up with the most accurate way of executing a comprehensive implant treatment plan for our patients. So the first step is to acquire a digital scan, intraoral digital scan using, for example, this system from 3Shape. As we can see here, the digital acquisition gives you a 3D rendered model of the patient mouth that you can actually combine with multiple levels of scans that you can integrate and gain a very accurate digital impression of the patient mouth. This STL file can be then transported to the implant planning software that we can use to integrate a lot of these workflows together and come up with the most precise implant placement position. طبعا يبقى السؤال, why are we doing all of this? Why are we going in the digital pathway? There's multiple reasons. One of the most important reasons is gaining accuracy while executing the surgical component of the treatment. Accurate implant placement, and this can be gained through collecting multiple information in the beginning, integrating all those information together and trying to come up with the most precise place for the implant placement. هنتكلم الآن عن الخطوة الثانية بعد intraoral scan. The second step is to gain a 3D radiographic impression of the patient jaw bones. And this is only done, or can be done, through acquiring a CBCT X-ray that gives you a 3D impression or 3D modeled impression of the radiographic impression of the jaw. From this, we can get enough information about the bone height and the bone width, and this is the second step of our digital workflow that gives us another level of information, وهذا يوضح لنا معلومة مهمة جدا عن الأماكن الجيدة or the potential sites for implant placement. So now we have the information, the initial information of the intraoral scan, and we have the second information, which is the CBCT or the radiographic information. This is considered as a DICOM file plus the STL file coming from the intraoral camera. These two files can be joined together into a software that helps in doing the surgery or the implant surgery entirely in a virtual platform. يعني احنا نجمع الملفين هذه مع بعض. As you can see, now we have the DICOM file that represents the bone from the CBCT and the STL file coming from the intraoral scanner, and they're all joined together. Zoom out. They're all joined together into one single file. Now we can place the implants virtually on the software into the most accurate position and the most favorable position from a surgical point of view, given the amount of bone available, and the most correct, restoratively driven implant position, knowing that the future crowns can be placed with no problems, giving enough restorative space available while the surgery is being performed later on by the surgeon. So the best way to transfer the virtually placed implants now into the most accurate position in the patient mouth is by means of using a surgical guide. As you can see now, the surgical guide is a tool that we use to transfer the implant position, both in the vertical and in the horizontal position, into the patient mouth. This is a virtually designed surgical guide. As you can see, this will control the apical position and also the horizontal position of the implant. And usually, in order to get this surgical guide, we can print this guide using a 3D printer. Okay, this is an example of a surgical guide, as you can see, that is 3D printed using the 3D printing technology. Now, how it looks in the patient mouth. As you can see, this is how it looks in the patient mouth. Okay, and these are the access openings for the implant placement that the surgeon can use to accurately place the implants as it is designed virtually on the treatment planning software. So in the surgical theater, this is how as you can see, the pilot drill that is used to align or do the initial alignment for the implant looks in place surgically through the virtually placed implant. Okay, so you can see this is the position here, and this is what the surgeon would use to accurately place the implant in the patient mouth according to the design. طيب، راح نتكلم عن تراك آخر وهو في حالات تأهيل شامل أو full mouth implant rehabilitation. For instance, we have this case. The surgeon extracted all these teeth that were hopeless and periodontially involved, and we ended up placing multiple implants into the maxillary arch, from which we have the implants placed in position now and ready for healing. The next step now is to wait for the healing to complete, and we took an impression for that case in the patient mouth digitally after the healing is completed via means of what we call the scan markers، وحنوريكم إياها بعد شوية في السنابة اللي بعدها. طبعا أكيد أنتم شايفين التطابق ما بين شكل الموديل هذا وبين الموديل هذا. So in order to get this virtual model, we started with an analog model, okay, that was taken from the patient mouth via conventional PVS impressions. A fixture level impression was taken from the patient mouth in order to come up with this model. What you see on the model here is what we call scan markers. السكان ماركرز هذه وظيفتها أنها لما نعمل لها سكان they accurately give us a virtual placement of the implant زي ما انتم شايفين. So the implant has been placed to the scan marker virtually, and this should represent the accurate placement of the implant in the patient's mouth with a very minimum margin of error. Okay, from there we can start designing the final prosthesis. As you can see, this type of prosthesis is an implant supported full arch fixed prosthesis. Okay, and we're planning to do a full contour zirconia implant supported bridge. طبعا هذه بعدين حتكون first step will be milled ل temporary وبعدين we'll try it in the patient mouth for several months لما نتأكد that the vertical dimension, all the other parameters are tested and everything works fine. We'll convert that to zirconia to be later delivered and screwed into the implants. Hopefully this will provide the proper support and function and proper aesthetic for the patient. So what we have shown is one implication of digital dentistry, as you have seen in implant dentistry practice. But this is not the only implication that we can use or utilize digital dentistry. There is multiple ways that we can utilize digital dental technology in daily practices, especially general practice. So why do I use digital workflows? It makes my life easier by means of having proper communication between me and my surgeon, and also it gives easier, more efficient communication between me as a restorative dentist and the lab technician. This is also gives you a better efficiency at work. It reduces the time of execution of the treatment, because sometimes you can collect all the data, CBCT, intraoral scan. So we can collect the data, the intraoral scan, along with the CBCT. We do the virtual planning. We print the surgical guide, and the next visit immediately the surgeon can execute the surgery in a very short mean of time. This will give me a more efficient practice, and of course it's going to be more cost effective for me from a financial point of view, and reduce the direct cost in my practice. So what we have talked about is only one digital workflow in implant treatment planning. But there are other implications for digital dentistry in other means of general practice. For example, crown and bridge or implant-supported prostheses. I'll show you one case that have a combination of implant-supported prostheses. As you can see, single crowns on these anterior teeth and a 3-unit bridge. Can you show us the prosthesis in separate formats? Okay, as you can see, the margins are clear. All these impressions are taken digitally. Okay, and you can see that this gives us an idea of the placement of the crowns specifically, accurately in the on the implants by means of screw retained prosthesis implant support. So we've talked about different applications for digital dental practices or digital dentistry in your dental practice. But the question remains, what could happen if you don't have access to such technology? Definitely you're going to do it the conventional way. There are multiple problems that can arise from that, and the number one problem is the miscommunication between the restorative dentist and the surgeon, and definitely the miscommunication that can happen also on the other line between the lab technician and the restorative dentist at the same time. We can see implants placed in the incorrect position. We can see crowns that do not fit and do not carry the proper shade after they've been delivered from the lab, because the lack of proper communication between different parties of treatment execution in the clinic, in the lab, and in the surgical. So as you can see, there are multiple digital workflows for different applications of digital dentistry. In implant dentistry and restorative dentistry, there is another aesthetic component, and this can be of more importance to periodontists in cases where there is excessive gingival display, or another word for that is gummy smiles. You can see this is one of the cases that was treated by one of the periodontists here in the dental practice, and we can see that we're having multiple or we're having an excessive gingival display. In order to get to that level of proper clinical crown height, we have to perform certain procedures, surgical procedures, but these surgical procedures, they need to be guided into proper measurements of how much gingiva need to be. So as we mentioned, this surgery needs to be guided, and from such a digital implication, we can precisely know exactly how much gingiva need to be removed in order to give a digital representation or superimposition of the proposed gingival display after the surgical procedure is completed. The step after that is to do a virtual design of what we call a surgical Perio guide. That is also can be 3D printed, okay, utilizing 3D printing technology, and I'll show you how we do that in a minute. So this is the surgical Perio guide that has been designed virtually and 3D printed. This is an occlusal view of that. As you can see, this is how it looks at the patient mouth. The exact measurements is the upper member of this window. That's exactly where the perio surgeon will remove from the gingiva. And we can see that this is a precisely excised gingiva. And later on, an osseous resection is performed and followed by sutures after an osseous recontouring has been completed. We can see the final results here, how the patient, after a certain amount of healing has been completed, we can see that there is proper clinical crown height has been exposed, and hoping after the complete soft tissue maturation and the healing has been completed, we will get a proper gingival contour with proper aesthetic results and pleasing results for both the patient and the performing surgeon. From this, we can understand that digital dentistry is composed of different levels of sources of information inputted all together and processed with a specific type of outcome that can be either printed or milled. It's very complicated, but I'll give you, for example, of what I use in my daily practice. As you can see, this is a first source of information, an STL file or a 3D impression, digital impression through what we call an intraoral scanner. This can be another source of information is the 3D CBCT X-ray. All of these can be composed together and they can be integrated, superimposed with a lot of processes that can be done here, either implant planning, or we can virtual implant, or simply we can use that for simple restorative procedures like simple crown and bridge or implant supported prostheses. All of this can be combined all together, so we can use digital dental practice in daily restorative procedures like crowns and bridges by means of 3D, by means of utilizing the latest technology in 3D printing. As you can see, this is a printing file ready to be sent to the 3D printer that I'll show you in the next snap. This is a finalized 3D printed model that we have acquired from an intraoral scan. We can see that this is printed from a 3D printer like this, and it takes about several hours for us to print a model like this one, okay? And we can utilize that into multiple ways and forms in order to either treatment planning for our patients or for executing certain treatment options. الآن نصل معكم إلى نهاية عرض اليوم عن the utilization of digital dentistry in multiple practices, specifically in implants, with a few glimpses about other digital implications and other fields of dentistry. أحب أشكركم على وقتكم وآسف على الإطالة. أحاول إني أغطي أكبر قدر ممكن، لكن لعله في وقت آخر وفي مناسبات أخرى إن شاء الله يكون لنا فسحة أكثر لتغطية شريحة أكبر من المعلومات عن هذا التريتمنت modality. أشكركم مرة ثانية، وطبعا نشكر المبدع محمود، هو الديجيتال ديزاينر اللي يعمل معي سبيسيفيكلي في تصميم الحالات هذه. شكرا يا محمود ويعطيك ألف عافية. طبعا نتعرف أكثر على هذا النوع من التكنيشنز وهم الديجيتال ديزاينرز. ممكن الأستاذ محمود تعطينا نظرة بسيطة عن نوعية الأعمال اللي تكون فيها في المعمل؟
بالنسبة لأعمال الديجيتال فمثل ما وضح الدكتور عبدالله، فموجود كل شيء تقريبا من الامبلانت بلانينج للكراون اند بريدج للامبلانت سبورتد للسمايل ديزاين للفينير، بالتقنيات الجديدة أو بالديجيتال دنتستري بشكل عام. فسهل التواصل بين الطبيب والدكتور، بين الدكتور والفني، بحيث أنه تكون النتائج جيدة جدا أو ممتازة بدون أي أخطاء أو أي تعارض مع الأعمال المخبرية.
في الختام ود أن أشكر أسرة aboutdent على إعطائنا هذه الفرصة للحديث عن هذا الموضوع المهم الذي أصبح محط الأنظار، بل أنه أصبح واحد من أكثر المواضيع نقاشا على الساحة هذه الأيام في عالم طب الأسنان. أتمنى أنكم استفدتوا، وأتمنى من الجميع أنه حصل على أكبر قدر ممكن من الفائدة. أشكر لكم حسن استماعكم ومتابعتكم. في حال وجود أي أسئلة أو استفسارات راح أتشرف بالرد عليها في سنابي، وكل التوفيق لكم وإلى اللقاء.